Hello, I'm Dr. Charles Newby, and I'm located in the heart of the UP in Iron River, Michigan, and I've been in practice for about 30 years. I like to specialize in clinical nutrition, endocrinology, and neurology. What we like to do in our practice is hopefully help people that have been looking for help, and they've come to our office because we'll have some answers and we'll have some investigation and some research to help them where they haven't been able to find the help. So we welcome you to our office, and thank you for taking the time to watch this DVD. What we're going to be talking about today is chronic fatigue syndrome. And we know a lot of people out there are suffering with chronic fatigue syndrome and severe chronic tiredness and fatigue. So what we want to do is hopefully provide you with some answers, provide you with some hope, and we're going to talk to you what makes us different from the other doctors that you've been seeing. Well, basically, we want to treat you neurologically and metabolically. So that means that we're going to be looking at your nervous system, and we're going to be looking at how your body functions so we can get to the root cause of what's causing your chronic fatigue. And there are many causes. So what we're going to do right now is we're going to talk about those different causes. So when a patient comes to me and they're complaining about tiredness, fatigue, exhaustion, run down, what we want to do first of all is look at the thyroid. And we do have special tapes that we've done right on the thyroid. We have a lot more information on the thyroid. So we're certainly not going to get into as much detail on this tape. But we must look at the thyroid. The thyroid can be misdiagnosed very easily. It can be underactive. And that's what runs your body. Your thyroid is what drives your metabolism, drives your circulation. That's what gives you a lot of your energy. So look at it as part of your engine. So that's the number one thing, is we're going to look at that thyroid with a full thyroid panel and making sure we're not missing anything in that thyroid. We also want to look at your adrenal glands. Your adrenal glands sit on your kidneys. They're small little glands but very powerful. They help to regulate your blood sugar, your blood pressure. They work with your hormones in your body. So we see a lot of people that are very, very fatigued and very tired from underactive adrenal function, because these adrenal glands actually are part of your fuel pump that gets your sugar into your bloodstream. So we want to make sure your adrenal glands are not underactive. The next thing we want to look at is digestive disorders. If you can't digest your food, you could be eating the best nutrition, trying to get organic foods into you, avoiding junk foods. But if you're not breaking down that food properly and getting the nutrients out of that food, good luck on trying to feel better, because you're not going to be assimilating and getting that food into your cell. So that's very important on that digestion. If you have what we call a toxic colon, meaning that your sewer department down here has been over polluted by many things that we've eaten over the years, such as fast food, toxins, poisons. A lot of that toxic poison can recirculate back into our system and certainly make us very tired and very fatigued. So we want to make sure you have good colon health. The total body toxicity also can occur from different poisons we've been ingested over the years, the environment that we worked in, foods and chemicals that we've ingested and eaten, different things that we put in our body, fumes, gases. There's so many places nowadays that we're absorbing all these poisons. These will translate into what we call heavy metal burdens, body burdens. So we could be picking up aluminum and cadmium and nickel and copper and arsenic, and all these things can poison our body, affect our nervous system, and overall affect our quality of health. So that could be a big cause of chronic fatigue. And if it's missed, chances are you're not going to get better. We want to look at your brain and nervous system. If your brain is not firing like it should be, if parts of your brain are sleeping and they're not as alert, of course you're going to feel tired, you're going to feel depressed. You're not going to be as alert as you want to be. You may have problems paying attention, you may have trouble with memory. These are all different signs and symptoms that the brain is not firing properly. A lot of times it's because of the cerebellum, the back of the brain has been stressed, and a doctor hasn't examined that properly to determine if that cerebellum needs to be refired up again. So other things that can affect this too is if your neck is out of alignment or your spine is out of alignment and there's pressure on the spinal cord, you're not getting full neurological energy to the parts of your body that need to function good. So we need our brain working at full capacity. We need those messages from our brain going down our spinal cord and to the 31 pairs of nerves. We need all that working to help you feel the best also. We also see a lot of men and women that have chronic fatigue that have hormone depletion. Let's say that a woman in her early age had a hysterectomy, or you've had different stresses in your life that have caused hormone depletion, and you've come in contact with different poisons or different chemicals that have caused a depletion in your body. This can cause a lot of chronic fatigue in your body. So we want to look at that and also make sure your hormones are in proper balance and they're at the levels that they should be. We don't want to make sure that you're having too many hormones of one kind either. A lot of women out there become estrogen dominant, meaning from many things that they come in contact with, and it might be foods, it might be cosmetics they're using, it might be different chemicals that they've taken in the past. They can overburden their body with too much of one hormone, and sure enough disrupt a lot of that balance in your body, and also cause chronic fatigue also. So how can we find these things out? How can we determine all these things we've talked about and find out, do you have some of these things that are causing your chronic fatigue, or a majority of these, or all of these? Well, first of all, we're going to do metabolic testing. We're going to look at your blood, we're going to check thyroid function, we're going to look for anemias, we're going to look for digestive function, liver, gallbladder, look at your immune panel. There's many things we can pick up from the blood, so we're going to want to do a full metabolic panel on you. We're also going to want to look at those adrenal glands we talked about. The way we can test those adrenal glands is from a ASI. It's called an adrenal stress index. We actually do that by saliva. So we have these kits in our office that we give you. Some of these tests you can take home and do, send them off to the lab. Some of the tests we might have to send you out to get your blood drawn. But we use companies that have been tried and true for years and years. They specialize in this work. We pick the best company or the best lab that specializes in a specific area of the body that we want to test, because we know they're going to be the most accurate and be at the gold standard we want them to. So when we look at those adrenal glands, we look also at the hormone levels, we look at cortisol levels, we look at DHEA, and at times we may want to do a stool analysis. The stool analysis will tell us if you do have any sensitivities to certain foods that you could be reacting to. Those foods will affect your immune system, and your immune system will cause you to be fatigued and run down if it's being challenged and overreacted all the time. The way we look at the metal body burden, as we discussed before, is through hair analysis. We want to take a sample of your hair. That biopsy will tell us at the deep tissue level of your body, is there any of those heavy metals that we're concerned about that could be influencing your body's ability to function at its best. So I think we talked enough about all these different areas, the causes of chronic fatigue. I know you're tired of searching for the answer, but we feel if we have you come in our office, we evaluate you properly, look at your symptomatic picture, run the right tests, we're going to find the problem and have an answer for you. So what we're offering through this DVD and through anytime you call our office is a free consultation. Your first visit would be at no charge. Through that first consultation, we're going to sit down, look at your history, look at all the tests that you probably run before. We might want to consider doing an examination, looking at your nervous system, looking at the way some of these glands and organs are functioning in your body, and make sure that we're not missing anything. So if you want to call our office at 906-265-5175, we'll be glad to schedule your first appointment. You can also get a hold of us on our website at www.NewbyDC.com. There you can also click on our office tour, see how our office, all the services that we have to offer in our office. You can click on some testimonials there, look at some of our satisfied patients that we've had a lot of success with, or you can also email us at www.NewbyDC@yahoo.com. So thanks a lot for watching this video, and we look forward to seeing you, and we'll certainly look forward to helping you with your chronic fatigue. Thank you.